My talk today will be on a clinical trial that was conducted at Alexis Health Center in Medellin Province during 2018 to 2020. The main focus of this trial was on preventing postpartum malaria. We had hoped that by administering artemisinin combination therapy at delivery, we would improve maternal and infant outcomes in malaria endemic areas. The design of this study was an open-label randomized controlled trial, and we aimed to reduce the incidence of malaria in the postpartum period in malaria endemic areas through the administration of artemisinin combination therapy, or ACT, as prophylactic treatment at delivery. The targeted sample size was 180 participants. A computer-generated sequencing was used to randomize participants using the 1:1 ratio to the no treatment arm, which is the current practice nationwide, and the ACT arm, which is the intervention arm. A further 1:1 randomization of the ACT arm was done to randomize women into the artemether-lumefantrine group and the dihydroartemisinin piperacin group. The primary endpoint of this study was the incidence of site-positive malaria throughout the duration of 6 months postpartum. 291 women who attended Alexis antenatal clinic were assessed for eligibility, of which 183 were eligible and were enrolled into the study and randomized. By the end of the study, 151 entered per protocol analysis, 71 of which were in the no treatment arm, 40 were in the DP and AL group respectively. This graph shows the percentage of women who remained malaria-free by microscopy throughout the first 6 months postpartum. The blue line denotes women in the no treatment group. The green and the orange line represents those in the AL and DP groups respectively. Women in the ACT group were significantly less likely to develop site-positive malaria in the 6 months postpartum as compared to women in the no treatment group. Between the two ACT arms, AL and DP, there was no significant difference. One of the parameters used to assess maternal outcomes was hemoglobin concentration. This graph shows the mean hemoglobin concentration between the three groups throughout the 6 months duration. As noted on this graph, there was no significant difference in baseline hemoglobin concentration between the no treatment and the ACT groups. The mean hemoglobin concentration, however, increased by 15 grams per liter in both groups by the end of 6 months. When the effects of HB were explored between the AL and DP group, there was a significant increase in HB concentration in the AL group as compared to the DP group. In conclusion, a treatment course of ACT administered at delivery halved the incidence of malaria infection in the first 6 months postpartum. Also, women in the AL group had significantly improved HB concentrations by the end of 6 months as compared to the DP group. I would like to acknowledge the following for their contribution to the successful completion of this clinical trial. Thank you.